you
This
all for
conference will now be recorded.
Okay, it's now being recorded. Thank you all for joining us. Welcome to the Healthy Homes, Healthy Workspaces webinar hosted by the Florida Department of Health and Miami-Dade County's Office of Community Health and Planning and the Consortium for Healthier Miami-Dade. My name is Candace Schottenlohr, and I'll be moderating today's webinar with our guest speakers, along with Bree to facilitate the questions and answers discussion later on. Today, you'll hear from local experts and local professionals on the many ways you can practice healthy behaviors at home and while at work, depending where you're at, and how organizations can support your efforts. And a few items to note before we begin. We'll be recording this webinar for future use and for your review as well. And after this, we'll be sending an email with the slides from today's presentation, so you have a copy of this information and an evaluation on today's event. Thank you so much. So let's go ahead and get started. So the next slide, we'll be discussing for the Healthy Homes section of our presentation of our webinar, we will have Leonie Perez, who is a community dietitian with Nicholas Children's Hospital, present to you today. Leonie joined the Nicholas family in 2018 to deliver the programmatic component of Give Me 5, which this program is a community nutrition outreach program under the partnership between Nicholas Children's Hospital Foundation and Kohl's Care, created to increase access to fruits and vegetables, provide nutrition literacy, and to empower communities to participate in healthy lifestyles. Leonie earned her Bachelor's of Science in Dietetics and Nutrition from Florida International University, FIU, and holds a Certificate of Training in Childhood and Adolescent and Adult Weight Management by the Commission on Dietetic Registration. She co-chairs the executive board and chairs the Health Promotion and Disease Prevention Committee of the Consortium for Healthier Miami-Dade. She sits in the Wellness Committee of the South Florida Hispanic Chamber of Commerce and the United Way Health Impact Council to help shape the initiatives that impact the wellness of our community. So without further ado, we'll go ahead and have Leonie present. Next slide.
All right, welcome everyone. My name is Leonie Perez. I am a registered dietitian, and today I will be presenting to you on the nutrition to stay healthy at home. I've been looking forward to this presentation because there's so much information that I want to share with you, and I know that you have a lot of questions, so we're going to go ahead and get started right away. Next slide. Good nutrition is super important to build a strong immune system. A strong immune system is your strongest ally to combat diseases and illnesses. Not one particular food, it is going to help you prevent illnesses, or it's going to help you build a strong immune system, but a combination of different foods. And we're going to go over those foods so you know how to build a strong immune system. So next slide. Thank you. Antioxidants. I'm pretty sure you have heard about antioxidants a lot. It is a very popular name, but antioxidants are my favorites. I like to call antioxidants the superheroes because they will protect your body from the inside out. Every time you eat, you breathe, you drink, you exercise, your body produces free radicals. And these free radicals are the ones that will cause damage and will cause illnesses inside of your body. The antioxidants will sacrifice themselves and will trap these free radicals to either prevent them from causing damage or taking them away from the body. So we're going to go and talk about the different antioxidants right now. Next slide. The antioxidants are called carotenoids. We have over 600 types of carotenoids. The most popular ones are beta-carotene, lycopene, lutein, and zeaxanthin. What you need to know about these antioxidants is their colors. Their colors is the giveaway of what it is that you're eating and what it is that you need to look for. Nature has a very smart way of letting us know what are the things that we need to eat. So for example, and this is not exclusive, but all the fruits and vegetables that are yellow or orange are going to be rich in carotene. And carotene protects against age-related macular degeneration and certain types of cancer. You will be able to detect this pigment by the color of the fruits and the vegetables. You will find that in butternut squash, tangerines, passion fruit, carrots, papayas, all the obvious ones. Then we have lycopene. Lycopene is perhaps one of the strongest antioxidants, and you will be able to detect lycopene by the color, and the color is red. The lycopene will protect you from heart disease, and it's going to give you strong cardiovascular health. You will find lycopene in tomatoes, pink grapefruit, papayas. Now, papayas are not red, but papayas also have lycopene. So that's why I say it's not exclusive of the color. Lutein and zeaxanthin are also very powerful, and these have anti-inflammatory properties. They offer protection, again, against age-related macular degeneration and cardiovascular disease. You will find these strong antioxidants in spinach, kale, broccoli, the dark green ones, but you will also find it in pistachios, papayas, avocados. The carotenoids, the giveaway from this slide is that combining different colors when you are creating your meals is the best way to make sure that you're eating the different antioxidants. Now, the question that I always get is, how about if I don't like to eat fruits and vegetables? Can I take a supplement? And the answer is that supplements will give you these antioxidants, but research have shown that they're not as effective in protecting your health as when you get it from the fruits and vegetables. And the reason for that is because fruits and vegetables not only are rich in antioxidants, but they have other components that together will give you a greater benefit. So next slide. Polyphenols. This is the other components that I was talking to you about. The polyphenols are not antioxidants, but these are compounds found in plants in general. And these are created by stimulus of the environment. This right here is perhaps the strongest benefit that a plant-based diet will give you. The combination of the antioxidants with the polyphenols. I like to think that the polyphenols are the sidekicks to the antioxidants, and together will give you the strongest benefit. Now, these polyphenols are being researched a lot right now. This is new, and we're going to be seeing a lot more through the years. But I can tell you a recent study on strawberries showed that within 1 hour of eating strawberries, you're already getting the benefits of these antioxidants. It cannot last up to 90 days. So imagine you're eating a strawberry today, and 3 months later, you're still getting the health benefits of eating this fruit in your body. How amazing is that? And then, as you can see, dark chocolate is also rich in flavonoids. So when you combine strawberries with dark chocolate, not only is it a delicious snack, but it's a healthy snack. And I know some of you had questions about snacks. So this right here is an opportunity to get creative with your fruits and your vegetables and see what they're rich, and then you will be able to get the best benefits. Another one that is becoming very popular right now are the polyphenolic amides. As you can see, oats are there. Oats, we know that oats are going to help you decrease LDL levels. But they also have a polyphenol that not only will help you decrease the LDLs, but they will decrease the inflammation caused by the LDLs. So you have double protection just by eating oats. And overnight oats, as you can see in the picture, are super popular right now, and they're super easy to make. Sometimes you can eat that for breakfast, or you can have that as a snack throughout the day. and they're super easy. There are many variations. You can do them with regular milk, or you can use yogurt or almond milk or soy milk, the oats, and then add some fruits and different seeds. And that is a delicious snack, and it's a very healthy snack. So what I want you to do from this slide is get and see the different options and try to combine them so you can get the best benefits. Another one that is very popular right now is turmeric, and turmeric has been shown to produce some weight loss. Now, one of the things that you should know about nutrition is that more is never better. So that doesn't mean that just because they're going to give you health benefits, you need to eat a lot of it. As a matter of fact, there are indications that more will actually cause damage. So let's just stay with moderation, a little bit of everything, different colors, different fruits, different vegetables, and a lot of moderation. Next slide. Okay, vitamin E. Vitamin E is also a very strong antioxidant, and when it works together with vitamin C, it is going to give you the strongest protection. You will get vitamin E from green leafy vegetables and a lot of nuts and some vegetable oils. The RDA for vitamin E is 15 milligrams per day, but 90% of the adults in the United States are not meeting the recommended dietary allowance for vitamin E, and this is unbelievable. We have so many fruits and so many vegetables and so many nuts, and we're not meeting our recommended dietary allowance, and we need vitamin E to build a strong immune system. So the next time you're making a salad, make sure you add green leafy vegetables, perhaps some almonds, perhaps some sunflower seeds, and there you have it. You have a good source of vitamin E. Next slide. Vitamin C. Vitamin C is perhaps the most famous of all antioxidants. Everyone knows about vitamin C, how it helps improve an immune system, and together with the vitamin E, they will make the best combination. Cooking with foods rich in vitamin C is very easy. For example, in that picture, you see mangoes and watermelon. Mangoes and watermelons are in season right now in Florida, right here in our backyard. And they have the most nutrition when they're locally grown. 51% of the Floridians are not meeting the recommended dietary allowance for vitamin C. We need to eat more fruits and vegetables, and there's a list of the fruits and vegetables that are high in vitamin C. The recommended dietary allowance for vitamin C is 65 milligrams per day for females and 90 milligrams a day for males. Most people drink 500 milligrams of vitamin C a day. I've seen people taking about 1,000 milligrams per day. 500 milligrams a day is fine. Next slide. Vitamin D. Vitamin D is also very important for the immune system. And a lot of people have low vitamin D levels, and low vitamin D levels have been linked to an increased risk for cancers of the breast, lung, colon, and prostate, multiple sclerosis, diabetes, hypertension, arthritis, and now COVID-19. Getting vitamin D is very easy. You can produce vitamin D with exposure to the sunlight, and just 5 to 10 minutes every day will help you. Well, something that you should know about vitamin D is that you can deplete your stores very quickly. We can only store vitamin D in our body for 2 weeks. So if you are at home and not going out very frequently, you can deplete your vitamin D levels very quickly. So I want you to pay attention to that. If you're not able to eat the foods that are rich in vitamin D, please take supplements. But having good vitamin D levels is super, super important. Next slide. Protein. Protein is also super important for the immune system, and also a source of zinc, which is also important for the immune system. The recommended dietary guidelines for Americans is that we need to eat seafood 2 times per week, eggs 2 to 3 times per week. When we're going to eat meat, it has to be lean, poultry, or chicken. It can also be red meat. And we can have legumes or nuts for the people that are following a plant-based diet. And if you're not following a plant-based diet, at least one day a week, make it a vegetarian day for your overall health. And it's also very easy to do. I put some examples there. Next slide. Yes, I want to talk very quickly about healthy fats. We have polyunsaturated and monounsaturated. Now, polyunsaturated are being researched a lot lately, and you've been hearing a lot about polyunsaturated. As a matter of fact, research has come back saying that polyunsaturated may be better to protect the cardiovascular health than monounsaturated fats. So when we talk about polyunsaturated fats, we have omega-3s and omega-6. The omega-3s are the ones that are the most concerned because not a lot of people eat the omega-3s. Some people don't eat salmon, don't eat a lot of fish, especially kids, and we need to have the omega-3s. The omega-3s are anti-inflammatory. The omega-6 are pro-inflammatory. That doesn't mean that you do not have to eat the omega-6. We need that too. Omega-3s and omega-6 are both essential. That means that our body cannot produce it and we need it. So those are some examples of the foods that you can eat. So you can eat more of the omega-3s and the omega-6. And the monounsaturated continue to be a good choice. If you don't know what you're eating, I like to look at that tool. I put the link there in that slide. You can always go to that site and see what it is that you're eating and what are the nutrients that is providing you. That's an excellent tool. Next slide. Okay, so this is a healthy plate. This is how you build a plate. You need to have your grains, a lean protein, fruits and vegetables, and maybe a healthy fat like the avocados there, a glass of milk, and that's how you build a healthy plate. Next slide. We also want you to limit calories from added sugars, saturated fats, and we want you to cut back on sodium. Next slide. Remember, every time you eat, you have an opportunity to eat healthy. You have an opportunity to feed your family healthy foods. Look for colors, look for variety, always fruits and vegetables, some type of protein, healthy fats. Combine your meals. Remember, every time you eat, you have an opportunity to eat healthy. And next slide. And this presentation has been brought to you by Give Me 5, which is our initiative with Nicholas Children's Hospital to educate the community on the importance of eating fruits and vegetables. And that is my presentation. I think I did not go over my 15 minutes.
Thank you so much, Leilani. Next slide. Okay, now for our second part of the Healthy Homes section of our webinar, we will have Rev Vanessa Tinsley, who is the Executive Director and co-founder of Bridge to Hope. We wanted to have a local expert in our community today to present to you. Vanessa is a Miami leader, class of 2016. She has a certificate in nonprofit management from the Florida Association of Nonprofit Organizations, a bachelor in theology and a master's in worship arts, a business degree from Miami-Dade, and is completing a college certificate in digital marketing. She is an ordained minister, spiritual leader, and advisor who spent 30 years teaching fine arts, sacred studies, and religion, and also served as chaplain and director of family ministry in the Episcopal Diocese of Southeast Florida. Vanessa began working as a public and motivational speaker since 1994 and has presented at many conferences in the US, Spain, Puerto Rico, and the Dominican Republic. Vanessa is a graduate of the Social Entrepreneur Bootcamp, Florida Thrives, and the District 8 Nonprofit Academy. Her life mission is to leave people better than I found them. Without further ado, we'll have Vanessa Tinsley speak to you all. Next slide.
Oh, thank you so much. And Leanne, thank you for that wonderful presentation. I think looking at all that delicious food made me a little bit hungry. So as stated, I am Vanessa Tinsley, and I'm the Executive Director at Bridge to Hope. And as you can hear, I have a little dog. And raising a ruckus right now because somebody's coming through the front door. I want to commend all of you for attending, and thank you for investing your time to be here, learning how to care for yourselves during this crisis and for your family. This is very important. Let's go to the next slide. Beyond being the executive director at Bridge to Hope, what really informs my mission is being a mother of 7 and a grandmother of 14, and I am now a great-grandmother of 1. And so I understand generationally the importance of caring for yourself, caring for your family, and the way food and proper nutrition contributes to longevity and family happiness. Bridge to Hope has been around. We've been making an impact here in Miami-Dade for over 30 years. We provide wraparound supports that improve the health and economic outcomes for our low, moderate, and in crisis families here. We desire to build stronger, happier, healthier families through these basic supports. Next slide. We are here because food is essential to well-being, to our health, and to the quality of our lives. Stuff happens, as COVID has shown all of us, that many of us are just one disaster, be it a hurricane, a financial crisis, a job loss, or an illness, away from not being able to provide for our own basic needs. Sometimes we all need a little help, and Bridge to Hope is here to be that help. One of the things that people experience when they are in crisis is a loss of hope, depression, anxiety. We have discovered that hope ignites action. When we help people meet their basic needs, they are able to work with us to improve their own outcomes. Next slide. So why is food so important right now? And Leanne touched on many of these, but one very important thing that we need to understand during COVID is that any type of financial crisis often leads to poor food choices, and those poor food choices impact health because our food is often the last flexible expense that we have. Our mortgage, our light, our rent, our car note, none of those are flexible expenses. They are due when they are due. What happens with so many of us is that when we are facing a crisis and we have a loss of income or reduction in income, we begin to manipulate our expenses. And one of those that is very easily manipulated is our food budget. We can see immediately the impact of not paying the rent. We can see the impact when we don't make the car payment and they tow off the car. We don't see the impact of making those poor food choices. We can always have ramen noodles for 39 cents and call that lunch or dinner and feel like we've gotten away with something and saved ourselves a few dollars because we don't realize that it is often not until years down the road when we start to see obesity and high blood pressure and many of the other things, stroke, increased heart disease, many things that happen to our health as a result of making these poor food choices. Pseudo foods, as I like to call them, have a lasting impact on health. We eat a lot in this country of processed foods anyway. Processed foods are much cheaper. You can buy a whole bag of chips and some ramen noodles and other things that are very inexpensive, dried pasta, and those things are so much cheaper than avocados and Fuji apples and almonds and things that will sustain our health. So it's very easy to fall into that trap of buying things that aren't really food. And those things will have an impact on your health, if not today, down the road. Leanne, I didn't know that about strawberries. So I think that really goes to prove the point that what you eat today is still around in the future. And it's very important that we make sure that we are putting good things into our bodies. There have been a number of studies done on food insecure households, and on average, they spend more than $1,600 more each year on their healthcare costs. That's over $77 billion that we spend in the United States just on health-related issues related to the kinds of foods that we eat that are not good for us because we are food insecure. That's a little scary, I think. Food also impacts our mood, and we are often not nearly as aware as we need to be about how the food we eat impacts the way we feel, not just physically and not just on our energy level, but it directly correlates to our mood, to our ability to focus. So all of these things are incredibly important. Right now, during this COVID crisis, we need the immune support that healthy, nutritious food gives us. We need the mental and emotional support that healthy, nutritious food gives us. We need to be avoiding the sugary foods, the dyed foods, and the processed foods, and we need to be opting for foods that do help improve our mood and our health. And those are things, as Leanne already mentioned, nuts and dark chocolate and hummus and fresh fruit smoothies. And I'm going to tell you a little bit about how you can access that stuff even without any money right now during this crisis. And I really strongly encourage you to do that and to share this information with others who may have trouble accessing the healthy food that they need right now. During this crisis, we need to be mindful of not only what we're eating, but why we're eating. If we're eating out of boredom or for other reasons that may not be the right reasons to be eating. So let's go to the next slide. I'd love to talk to you a little bit about where to find health, but I want to just take a moment before we move to the next slide to encourage you to share this information with your tribe. Many people are far too embarrassed to ask for the help they need. So please don't assume that everyone has the food that they need, and just share this information on your social media network with your family and friends and whoever happens to be in your tribe. Now is not the time for us to lower our nutritional standards. It's actually the time for us to be ramping it up so that we can improve our immunity and our sense of well-being. So having said that, let's move to the next slide and we'll talk about some resources that are out here in the community to help you. So here is a great link at Miami-Dade.gov. Miami-Dade has a complete listing of the many resources that are available today, including the food distribution events. And what you're seeing is just a snapshot of just some of what is on that page. There is a PDF that is regularly updated so you can see where these drive-throughs are located every single week. There are some that are ongoing, such as the one that's at Tropical Park and the one at Air Base Park on Wednesdays that happen every single week. The summer food service program, there's information about that. And the senior food distribution, which is an incredibly important resource for our seniors. They can have meals directly delivered to their home each week, and there's no charge for that. So there's no reason for any of our seniors to be going hungry, and those meals are well planned to be nutritionally balanced. So they're excellent. There's also access to where to apply for services. So if someone needs to apply for food stamps, for instance, all of that is available right there at the Miami-Dade.gov services page, and they're all, for whatever reason, on the food senior services page. So that's why I gave you the link, is so that you won't have trouble finding it. If you look for the senior services, all the services are there, as well as the ones that are specific for our senior citizens, and that is a wonderful resource. So next slide, please. Feeding South Florida, I'm sure many of you are already familiar with the many services that Feeding South Florida provides. They do provide services in all of the South Florida area, from Palm Beach all the way to Key West. They have hundreds of agencies that they provide food through, and they have this resource on their website where you can locate an agency. You can search by zip code or by address. And in addition to finding an agency that has a food pantry open or a community kitchen or a soup kitchen, you can also find their contact information. You can see their hours of operation and have some general idea what services they provide. Next slide, please. In addition, Feeding South Florida has an absolutely wonderful program. It's called The Last Mile, and it is a home delivery service that is designed for older adults or for people who are homebound, people with medical conditions that would be identified as high risk, and for those who may not have access to transportation. So the Last Mile home delivery service is done in partnership with Lyft and also with UPS, I believe, are the two that are making deliveries for them. In order to access the service, all you need to do is to call Feeding South Florida, and the number is on this slide, and request that service, and the food is brought twice a month directly to your door, and it is milk and dairy products, as well as protein, usually in the form of chicken, and a nice variety of fresh fruits and vegetables. Again, this is a wonderful service, and it is completely free of charge. So if you or someone you know needs to have access to food and is not able to get to it, I strongly encourage you to reach out to Feeding South Florida for this very wonderful and important assistance. Next slide, please. Some other places that you can find help for yourself or for a loved one. There is a referral service, AuntBertha.com. AuntBertha.com is actually a nationwide service, so if you know someone or have family living outside of Miami-Dade County that may need some help, you can search at AuntBertha.com by zip code and specify the type of service that you need. Not only do they provide information on food resources, but also resources with help for paying rents and utilities and other very important services that might be needed. The JCS here in Miami-Dade County also operates a site, and their link is here in this slide. They have assistance with employment and with housing and with healthcare and mental health services, clothing, transportation, food, anything that you could need. They have that information on who the providers are here in Miami-Dade County. They have hundreds listed. They are wonderful people to work with, and I strongly encourage you to take advantage of that resource if you find yourself in need of any kind of services in Miami-Dade County and you're not sure where to turn. And of course, next slide, please. Bridge to Hope, we're also here to help. We have adopted a model outside of just the traditional drive-through models. We have a service called Park and Pop, where people can make an appointment and come to our warehouse in Cutler Bay to receive an abundance of fresh food. Our focus is on fresh, nutritious, and healthy food. So fresh fruits, fresh vegetables, proteins, and staples are our mainstay. We're not going to just hand people a bunch of canned goods and dried pasta and send you on your way. Most people find that we give about a week's worth of food on average for a family of 4, and that appointment can be made directly on our website, which is bridgetohope.net. There is also a contact us on that website. If you need food more urgently, then the appointment may be available. We're serving 12,000 people a month right now, so the appointments do go quickly, but if you have an urgent need and don't find an available appointment, you can reach out to us on the Contact Me page, and we will get back to you very, very quickly, and usually are able to serve within 48 hours. We also operate a hub at the Garden in Overtown, and on the third Saturday, we are at Redland Christian Academy on Chrome Avenue in Homestead, and we provide food for about 500 families on that particular day. Next slide, please. And I just want to say, if you do make an appointment for the Park and Pop, that average turnaround time for that service is about 10 minutes. So literally it's in and out. So if you're concerned about being in long lines, that's a wonderful option. You will not have to wait long at all there. Our contact information is here. This is our website and our email and our phone number. We are available every week from Tuesday through Saturday. We are closed on Sunday and Monday. And that concludes my presentation. Thank you so much.
Thank you so much, Vanessa, for sharing about Bridge to Hope and, local community updates. So that concludes our Healthy Homes segment of this webinar. And now we'll go on to our Healthy Workspaces of our webinar. We would like to introduce Nathan Brandt, who is the Benefits and Wellness Program Manager of Florida International University. And he oversees the wellness program and the implementation of new programs and initiatives. Nathan has been working with the consortium for a Healthier Miami-Dade for over 5 years now and is the chair of the Worksite Wellness Committee of the Consortium for a Healthier Miami-Dade. So we will now give the floor to Nathan.
Thank you, Candace. I want to welcome everybody here. We're going to have an interesting discussion today, talking about ways to really stay healthy at work and making sure that when we say that, we're also keeping in mind the new norm of staying home, working from home, and things like that. So we'll be talking about how to stay healthy at work, why worksite wellness is important, and why employers should really adopt worksite wellness initiatives, and the ways that they can do that. So let's go ahead. We're going to move on to the next slide, and we'll get started. So the first thing we're going to talk about is that a big chunk of our lives is spent working. The other part is sleeping, and that's also part of staying healthy, but we'll talk about that in a little bit. So we are doing a lot, and there's been some studies and some other discussions. There's been some other reports that have said that now with the telework, people are actually doing more. They're doing more work, less interruptions. They're getting, in some instances, more done, but it does take a toll. So the first thing we're going to talk about then is how to stay healthy while teleworking. Now, this is going to be extremely important because we really don't know the time period that we're going to be doing this from here on out. Many of us, it's an open-ended question. It's not going to be answered anytime soon. So with that, the first thing you're going to want to do is to make sure to have a schedule. We tend to be creatures of habit, and we tend to like more control. And in order to maintain a sense of both, creating that schedule will help. And it's a wonderful opportunity for you to initiate new habits. Now, for many of us, the act of commuting is no longer there. So that can replace or be replaced with a healthy habit, whether that's working out prior to work, working out, going for a walk, doing something that's mindful, being able to practice some self-care. Those 2 time slots now in your day are open. They weren't before, but they are now to help take care of yourself. So creating that schedule is extremely important. And one of the things that you're going to want to make sure that you do is stick to that schedule. So then it becomes more habit-like. It will also help you create those boundaries and create that sense of balance within your work and the rest of your life, that separation, so to speak. You're going to need to find what works best for you. There's no one size fits all for everybody. You know, you're your own person. You have your own habits, likes and dislikes. You have your own way that you like to handle your priorities and your work. So that schedule is going to be completely personal, and it needs to be what works for you that allows you to feel more at ease in the work that you're doing while you're staying at home. So with that and creating that schedule, you're going to have to work at creating boundaries, being able to set up opportunities where it's okay to say no, that you're not going to continue to work until 7, 8, 9 o'clock at night. That when that time comes and it's time to sign off, you sign off. I like to tell a lot of our employees that the work is going to be there in the morning, unless it's crucial and highly important, or if it means you don't do it today and somebody doesn't get paid, then you might want to finish. But if it doesn't have anything to do with such a priority as getting paid or safety, it'll be there tomorrow. Just because you have that access to work doesn't mean you lose your sense of home and separation from your work. You want to make sure to identify your support system. Now, what I mean by that, so we are ultimately connected to anything and everything now. Everything's at our fingertips, but we've lost some of that social connection. And I like to tell people that we might be socially distant, but it doesn't mean we can't be socially connected. Now, you're going to need to really find out and make an initiative to stay in contact with people, whether it's your friends, family, colleagues. You're going to want to make sure that you talk, and it's not always going to be that straightforward work talk. Some of it will be the water cooler talk. Some of it will be a little bit more personal. You want to really try to find that personal connection again and to keep it. And why am I saying this? Well, mental health. Mental health has taken a ding with the increased telework, with the increased isolation, and it's extremely important. We're social creatures. We really thrive and strive off of the ability to be with and be around each other. And the time has really created an instance where it's difficult for us to do that. But just being socially distant doesn't mean you can't stay socially connected. Make those phone calls, those video chats, anything that you can think of to stay connected. I know that in this time now, I spend a lot of time on Zoom, and I will say that Zoom fatigue is real. So you're going to need to monitor that and make sure you maintain your boundaries with that too. I find myself at times with where my day has had a lot of Zoom meetings, I'm exhausted at the end. Always feeling like I'm on, having to try to get a sense of the person through a more or less two-dimensional, instead of being in the same space with them, where I can read the body language, I can feel the energy. Here, it takes a lot more of my mental energy to stay up and on, but it's necessary. But I find myself now, I call my parents all the times. I call, my sister, my friends, my colleagues, just to hear a different voice, just to be able to bounce ideas, just to be able to stay connected, because it's extremely important when you're missing that in-person interaction. And that in-person interaction, I was talking with my roommate, and he's an engineer at FIU. And he's finding himself a lot more tired now too. When he worked at the lab, you'd have distractions. You'd have students coming in that would ask you questions, and it would allow your mind to do what it is necessary and not just stay hyper-focused on that given task at hand. And it would give your mind a rest to come up with the answer that you might have been seeking before. And now there's a lot of that distraction isn't the same. It's not, it can be ignored. That little chat box that pops up can be ignored, and you just continue to focus on your work. And it can be exhausting. So you want to make sure that you're staying in and creating those boundaries, that schedule, and maintaining that social connection in an appropriate way for you and all those around you. Now, while you're trying to stay healthy while working, some of us are also having to go in and work in the office setting. So first and foremost, you want to make sure that you maintain and create safe areas for yourself, and that your employer is maintaining, creating safe work environments for yourself. But the things that you have control over in the immediate is hygiene, making sure that you're keeping your hands washed, that you're wearing your mask, that you're socially distant, that you're doing all the things that are extremely important to keep yourself and others relatively safe. You want to make sure too that you keep your workstation clean and organized. That will help reduce your stress. That will also help your ability to wipe down your environment, making sure that it stays as clean as possible. You know, you want to make sure that you're really taking care of your space and yourself. And then also know, and this goes with teleworking and with in-office work, know when you need a break. You know, the recommendations are usually anywhere from 40 minutes to an hour. Get up and move for at least 5 minutes. Give yourself a rest. Let your brain, you know, really just soak in all the things that you're trying to do and find a mindful moment to let it process in a normal way without having to continue to pound at it. You know, you want to make sure that those breaks are often, because it allows you to help regenerate in some, but improve your mental health and your physical health and the energies that you're utilizing for each. And as Leilani mentioned previously, you know, nutrition is a huge component of maintaining, creating, and staying healthy. You know, when I was a strength and conditioning coach, I always told my athletes that eating and sleeping were 90% of the equation. And I know others will tell you that it's 80, but in my experience, 90%, if you are eating well and you are sleeping well, you're going to be feeling well. And it's extremely important because it does impact your health and your work performance. You know, bring a lunch, choose healthy options at the restaurants, make sure that your plate is mostly vegetables and fruits with a side of protein. You know, and I know Leilani touched on that, and I said protein. I didn't say meat because there are those out there that are meat averse, and that protein source will come from other sources. So make sure that you're doing your part, because you're the only one that can really allow yourself to be more nutritious in your choices. And then last but not least, you want to make sure that you have options, ideas, and knowledge relating to stress management, doing things that will help mitigate and reduce some of that stress, allowing you times that will allow you to go for a walk, to break up those stressful moments, to allow yourself to meditate, to have some mindful moments. You know, there's a lot of wonderful apps out there that you can utilize that will help you if it's not your thing. Happify, there's Insight Timer. You know, there's just a lot out there, and it's really at our fingertips. So, you know, search and ye shall find. Next slide, please. Okay. So how employers can help. So during the situation that we're currently under, it's important to make sure that you are creating availability for the employees and everyone around to practice a healthy lifestyle. Give them the opportunities. Like we've mentioned before, many are teleworking, and this is the new norm. So being able to create new worksite policies that will help enact and create opportunity for healthy lifestyles is just one more opportunity for the employer to show how much that they think of the employee and how much they really care about the situation and what they might be going through and thinking. You want to make sure that you set everything up in ways that social distancing, cleanliness, and all the other opportunities are there. You know, you want to make sure that you enact other policies and resources that will allow the employee, whether it's the 15-minute breaks and allowing them to be able to go and do that above and beyond just their normal lunch breaks. Creating resources in there so that there's more choices at the site for healthier food options or healthier lifestyle options while maintaining social distance, while maintaining healthy hygiene, while being able to create certain components that will push your employees to be a little bit healthier, mindful, and know that you're really thinking about them and their safety. You know, you want to make sure too that they have access to other healthy resources that you can offer. So in addition to policies, there's newsletters and updates that can go out. There's improving snack ideas and videos with examples of exercises or different practices that they can do in their workspace. And on the next slide, we'll discuss a little bit about how the employers can help while the employees are working in the office during this time. So let's go ahead and move on and get a little bit deeper into it. All right, so in the office, continued, how the employers can help. So we wanted to discuss some ways how you as the employer can protect your staff and others to help slow the spread of viruses, especially with the current COVID-19 situation. So during the COVID-19 pandemic, office building employers, owners and managers and operations specialists, they can take the following steps to create a safe and healthy workplace for workers, clients, and everything in between. Employers can start by creating a COVID-19 workplace health and safety plan. You'll want to make sure to go ahead and review the CDC interim guidance for business and employers. There's a lot of great information there that can help you and get you started. Before resuming business operations, make sure to check that the building is ready for occupancy, that you have the opportunities and the setup that will create ability to work with social distance in mind, that will create opportunities to maintain healthy hand washing and hygiene. And then also to make sure that it's set up because there will be a reduced occupancy as well. Now, this is an opportunity to identify and address any health hazards and address them to implement new policies that include obviously social distancing, accessibility and availability, and then also cleaning items. And if anybody comes up and there is ever a positive case, what you're going to do to make sure to sterilize the area again, make sure that it is set up and ready to go so that they don't have to worry about, touching certain areas that were around a positive individual. So you want to make sure you have that plan and make that plan set up. You want to make sure to actively encourage sick employees to stay home, even if it's just the sniffles or something that they might say, yeah, but it's not, yeah, but you want to exercise an abundance of caution, not only to, obviously protect that employee, but you want to protect everyone else around you and the needs of the business as well. Employees who have symptoms, make sure that there is a process where they can notify easily, readily, and quickly. Make sure that there's an opportunity to work from home if they have to stay from home, to allow them an ease of, move from work at home, telework, work at home. I know at FIU right now, we have it set up to where there's certain options. So if there are certain things where people have to be on campus, but then there's something that happens, there's an opportunity then for them to continue with teleworking at home. So you want to make sure you have certain really implementations to try to keep that transition as seamless as possible. Now, again, you want to make sure that you have your policies, and when it comes to sick employees, follow the CDC recommended steps and guidelines within the workplace policies that you're implementing, utilizing, and creating. As an employer, it would be recommended to have a policy in place to help slow the spread. And then again, as an example, noted by the CDC, employees should not return to work until the criteria to discontinue home isolation quarantine are met in consultation with healthcare providers. Employees who are well but who have a sick family member at home with COVID-19 should notify their supervisor immediately and follow CDC recommended precautions. Now, this is an opportunity for employers to really take a close look at their current policies with the current situation taking place, and also try to look and utilize this opportunity with foresight. You really want to try to be as proactive as possible and not reactive, especially knowing that this is an open-ended This is an open-ended component of our lives now. So lastly, the employers can establish a worksite wellness program. It's obviously going to be different than what they have been in the past. And when you are establishing that program, make sure you're doing it with the hope of improving the health of the employees while also preventing injuries and illness in the workplace. Let's go ahead on and move to the next slide, please. All right, so why should employers adopt a wellness program? Besides the obvious, the overall purpose of a wellness program is to help promote healthy behaviors, environments, and to really be a huge impact in the community. Again, we had mentioned earlier that the employee is spending a big chunk of their lives in the work setting, and it would behoove the work site to take care of the employee, to help push and create opportunities for healthy behaviors and lower health risks. With that being said, one of the benefits of the programs like this is that employees tend to obviously make healthier choices. While the employers cannot make healthy choices for the employee, they can offer opportunities for them to make those choices for themselves. Second, employers will have a healthier workforce. So with about 3 in 5 Americans living with a chronic condition, it's important that the employers try their best to reduce the impact of such. The costs of lost productivity and missing days of work, are significantly higher than those who do not live with a chronic condition. So if you can make that impact, you can help reduce the chronic conditions or reduce the risk for certain other illnesses and conditions. That has a huge impact. Wellness programs have the ability to help with just about everything and anything that you can think of that is related to well-being, stress, chronic disease management, mental health components. Being able to provide the resources and tools needed is a huge opportunity here for the employees' health, well-being, and overall the community. Go ahead, next slide, please. So let's take a look at some examples of successes that have come from worksite wellness programs. The first one that you can see here is smoking cessation. So there have been reports of statistically significant reduction in tobacco use among employees. There was a time when you could smoke in hotels, you could smoke in restaurants, you can smoke in the place of business, and for the most part, a big chunk of that's been cut. And it's been to the benefit of not just the employee, but society as a whole. Now, other programs that there may be are aimed at weight and nutrition. So the employees have been shown to start to be more active, and they tend to choose better choices with the well-being or the wellness program that's in place. So what does this do? This helps increase weight loss, lower BMIs. It also helps improve mood and certain satisfactions that the employee will have with themselves. Now, these are just a few examples, but it shows that workplace programs aimed at improving health have lasting impacts, that they're not just one and done, that they're not just opportunities to, check a mark in a box. They're opportunities to impact lives, and they work. So let's go ahead and take a look at the next slide. All right. So what does the Worksite Wellness Committee do? Well, recently, we've been working with other partners like the DOH, Department of Health, Miami-Dade WIC program, Healthy Baby Task Force, and the Miami-Dade County Public Schools to collaborate and create a Worksite Wellness Toolkit. Now, this toolkit emphasizes the importance of adopting a worksite wellness program, and it allows you an opportunity to figure out what will be the best fit for your company and organization. It allows you to really see where you can improve, what areas are low-hanging fruit, how you can improve and create certain things over time, and what would be best suited for your workplace. Now, in order to be able to fulfill this process and have a successful program, you first need to assess your workplace. Now, an example is included to be able to do this by using the best practices from the CDC. So if you want to go ahead and take a look, you can go take a look at the CDC Worksite Health Scorecard. This will allow you to analyze and get a better understanding of where your work site currently sits. And we'll discuss a little bit later on that part, but it's a wonderful tool that you should have in your toolbox when you're looking at creating and maintaining and improving your worksite wellness program. Now, in the toolkit, we also discussed steps on how to plan for your worksite policy and best ways to market this within your organization. Additionally, a very important step is obviously the evaluating and monitoring your program and make sure that it's sustainable. So you want to make sure that you're creating points and pieces that not only can be maintained over time, but can hopefully grow into a much more robust program. In our toolkit, we also highlight breastfeeding support in the workplace. And if you're interested in learning more, we can also offer technical assistance for this and other types of policies. Lastly, we include best practices and we champion organizations that have had successful worksite policies and programs. We want you to know who's out there doing right by health and wellness and how they got to where they did. And with that, you can go ahead and look through the toolkit. That'll help. So as a result of the toolkit, the Consortium for a Healthier Miami-Dade Worksite Wellness Committee will be providing technical assistance to organizations in Miami-Dade County who's interested in the development of a worksite policy or further programming. So please stay tuned for further messaging, and we'll be able to share and follow this up later with details after the webinar. So the CDC Worksite Health Scorecard, it's a tool designed to help you assess whether the workplace and the programming that you're creating is evidence-based or not. So with the scorecard, when you're utilizing and creating the evidence-based health promotion interventions or strategies in the worksite, this will allow you to analyze that and continue to have a base score to see over time what is right, what is not, what is working, or what needs to be improved. The scorecard assessment tool includes 154 questions across 18 different topics. Now, these topics include background, worksite demographics, community engagement. There are 17 required questions, 3 optional questions. Organizational supports, tobacco use, high blood pressure, high cholesterol, physical activity, weight management, nutrition, heart attack and stroke, pre-diabetes and diabetes. Depression, stress management, alcohol and other substance use, sleep and fatigue, musculoskeletal disorders, occupational health and safety, vaccine preventable diseases, maternal health, lactation support, and cancer. We'll be able to show an example of the questions later on. We've also shared the link here where you can have access for the scorecard and help you learn more. Next slide, please. All right, so with the next slide, we wanted to really discuss who uses the scorecard and why is it important. Now, who should use it, public or private? Well, that's pretty much everybody. The reason that it's there is to be utilized by as many individuals, programs, and organizations as possible, because it really is a gold standard to allow you to see what your work site is doing, what it's not doing, and what are the best place practices that you currently would be able to implement within. Now, you know, when you look at a work site and where it's going to be housed, you're going to need to be able to decide, and the scorecard helps you allow where and how certain things should sit as well, especially within our worksite wellness toolkit too. It'll allow you to understand some of the different areas and the protections that'll need to be created for the worksite wellness program, whether it's health management, whether it's participatory It'll allow you the opportunity, though, to see where things are currently. Now, anybody that has the opportunity to within the organization can use it, whether it's the human resource manager, health benefit manager, the health education staff, nurses, medical directors, wellness directors, basically anybody that's responsible for the worksite health promotion in an organization should be the ones that actually have their hands on utilizing the scorecard. So why do you want to use it? Well, basically, the United States is facing an unparalleled health epidemic driven largely by chronic disease that are threatening American businesses' competitiveness because of lost productivity and unsustainable healthcare costs. The medical care costs of people with chronic diseases account for more than 90% of the nation's 3.3 trillion, in medical care costs. And this was back in 2009, and it's gone up since then. So what does that mean? Well, cardiovascular disease costs the United States more than $329 billion each year. That's more than any other health condition, and that includes $199 billion in direct medical costs and $130 billion in indirect costs, including productivity loss from premature mortality. So what does that mean? That means there are a lot of zeros attached to chronic disease that is costing in many different ways, not just in money, but also in lives, time, productivity, just about anything. So that's really one of the big reasons why you want to be able to utilize this to help get the wellness program to a place of actual help in relation to people's health, well-being, and self-care. Now, the approach that has proven most effective is to implement an evidence-based comprehensive health promotion program. Now, this includes individual risk reduction programs that are coupled with environmental supports for healthy behaviors and coordinated and integrated with other wellness activities. With that being said, only about 11.8% of U.S. employers offer a comprehensive worksite health promotion program, and that was according to a 2017 survey. Now, what does the scorecard tell you? The scorecard can be used to identify priority health topic areas, identify gaps in existing health promotion efforts, how to offer comprehensive wellness programs to employees, and that's really just the start of it. It's really an unheralded tool that needs to be utilized as much as possible to get you to that evidence-based comprehensive health promotion program. Next slide, please. All right, so this right here shows you a little bit of the CDC scorecard. And as you can see, its emphasis on this one is stress management. Now, the tool here highlights numerous health-based focus areas such as stress management, with each response given a rating. And then this factors into the organization's overall score. And you can see that here on the slide. Depending on your organization's overall score, steps will then be taken to either track progress or develop new initiatives. And this gives employers the ability to assess their current wellness programs and initiatives. Now, we've gone over a lot. There's a big component when you're talking about health and wellness programs, whether, again, it's that comprehensive evidence-based health promotion program, whether they're advanced enough to be able to do a disease management program, to anywhere from being able to just offer policies and opportunities to help improve the workplace, keeping in mind that we are in an epidemic, a pandemic, and that we need to take into account all the changes that come with that. So I want to really urge you to look at your current practices, to see what is out there in the best interest of the employees and the organization and community as a whole, and how best you can implement that. And we think we've done a wonderful job in creating the Worksite Wellness Toolkit that will help answer some of those questions, that will help steer you in the correct direction and that will allow you to really see all the resources that are out there to help get your worksite wellness program off the ground. So I want to thank you for taking the time today to discuss healthy homes and healthy workplaces, and make sure that you, again, create that schedule, that you create those boundaries for your own mental health and well-being. And again, if you need any resources, always check into a mental health provider, whether it's the Office of Employee Assistance or an EAP program. You want to make sure that you are taking note of how your mental health is doing and how you are doing, and not to just ignore it and continue to push through the entire day. The only one that can take care of you is you. And in the end, I know we do the best that we can, but sometimes we need to ask for that help. And that's why there are EAP programs and other mental health professionals there for you. So again, I want to thank you for your time and your well-being. And I'm going to go ahead and pass the microphone.
Thank you so much, Nathan, for that wonderful presentation on the healthy workspaces, you know, depending if you're in the office or teleworking. And so on that note, we know we're a little over time. We just wanted to share with you some last minute information about how to contribute to your overall well-being. And so we wanted to share a little bit about healthy eating and healthy living with MyPlate. And the USDA developed MyPlate to make your selection of appropriate foods easier. And so as the Office of Community Health and Planning and the Florida Department of Health in Miami-Dade, we encourage you to visit the website www.choosemyplate.gov, and you can see here on the side the bolded titles here listed are just some important tabs we wanted to highlight for you. And so starting simple with MyPlate, these are some tips and ideas on how to get started to that healthier lifestyle. And you can also get your own MyPlate personalized plan. And there's additional resources for you to access via digitally, infographics and videos and more. And so depending on who you're working with as well, there's also many different languages these materials come in. And also you can target, you know, if you're talking about adult populations and health, you can filter it that way or via children and families. And so at this time, we'd like to thank you all for joining us. We do know that some of you have submitted some of the questions prior, so we will be sending out a document with those questions and answers answered by our speakers. And also, if there's any questions in the chat box, we'll also include those. So we want to thank you all for your time, and you'll also be getting this presentation via email as well as the evaluation. Thank you all so much.
Thank you. Great.